A new study suggests that lower doses of the antibiotic doxycycline can effectively treat lymphocytic scarring alopecia, a rare condition in which the body's immune system attacks hair follicles. While this might seem like good news for patients looking for a safer and more tolerable treatment, the findings also highlight deeper concerns about antibiotic overuse and its potential long-term consequences. Although lower doses may reduce some side effects, they do not eliminate the broader risks associated with prolonged antibiotic use, including gut health disruption and the growing crisis of antibiotic resistance. Lymphocytic scarring alopecia can cause irreversible hair loss and scalp damage, leading many patients to seek aggressive treatment to halt its progression. Traditionally, higher doses of doxycycline have been prescribed, often causing unpleasant side effects such as nausea, vomiting, and rashes. This study, which analyzed the medical records of over 240 patients treated between 2009 and 2023, found that lower doses, around 20 milligrams twice daily, were just as effective as higher doses of up to 100 milligrams twice daily. Patients on the lower dose experienced fewer side effects and were more likely to adhere to the treatment, with 16% stopping due to gastrointestinal issues compared to 25% in the high-dose group. While these results may offer some reassurance, they do not eliminate concerns about the long-term impact of doxycycline use. Antibiotics, even at lower doses, can disrupt the balance of beneficial bacteria in the gut, potentially leading to digestive issues, weakened immune function, and an increased risk of other infections. Doxycycline is known to harm gut microbiota, and while the lower dose may pose a slightly reduced risk, it does not make it a risk-free option. Patients who require prolonged antibiotic treatment may still face unintended consequences that could affect their overall health beyond the immediate concern of hair loss. A more alarming issue is the role of antibiotics in fueling drug-resistant bacteria. The study's authors noted that reducing unnecessary antibiotic use is crucial in the fight against antibiotic resistance, a global health crisis that has already made certain infections harder, or even impossible, to treat. However, this study does not necessarily address the fact that even lower doses contribute to this growing problem. Any widespread use of antibiotics, even when deemed safer, adds to the selective pressure that allows resistant bacterial strains to thrive. While dermatologists and patients may welcome a more tolerable dosing option, it does not change the reality that antibiotic overuse remains a significant concern in modern medicine. Moreover, the study's findings, though promising, do not fully explore the long-term implications of prolonged doxycycline use for hair loss treatment. Many patients with lymphocytic scarring alopecia require ongoing management, meaning they could be taking antibiotics for extended periods. The study did not examine whether lower doses maintain their effectiveness over years or if patients might eventually require higher doses to sustain results. Without long-term data, it remains uncertain whether this approach provides a truly sustainable solution or merely delays the need for more aggressive treatments. Patients considering doxycycline, even at lower doses, should weigh the potential benefits against these risks. Alternative treatments, including topical therapies, lifestyle modifications, and newer non-antibiotic anti-inflammatory medications, may provide safer long-term options. Medical professionals must carefully consider whether antibiotic therapy is truly necessary, particularly for conditions that are not life-threatening. While the study suggests that lower-dose doxycycline can be effective, it should not be seen as a risk-free treatment or a justification for long-term antibiotic use. The findings ultimately serve as both a reassurance and a warning. While lower doses may reduce immediate side effects, they do not eliminate the broader health concerns associated with antibiotic use. Patients and doctors must remain vigilant about the risks of gut microbiome disruption and antibiotic resistance, ensuring that any treatment decision balances effectiveness with long-term health considerations. The medical community must continue seeking safer, more sustainable alternatives to antibiotics, rather than simply adjusting dosage levels in hopes of minimizing harm.